In today's Health Alert, it is World Pancreatic Cancer Day, an annual global event focused on raising awareness about one of the deadliest forms of cancer. Here to explain more is our Chief Health Editor, Dr. Partha Nandi. Thanks for being with us today. You're a gastroenterologist. You deal with this in your practice. This also touched my family. My mom battled this disease. Can you talk about how common this cancer is and why it moves so quickly?
Yeah, I'm sorry. We heard about your mom. It's just a devastating disease. And unfortunately, we see pancreatic cancer all the time. I see it in my practice more than I'd like to. And then the problem is that it's tough to catch early, and that's why it's often called the silent killer. Globally, it's the 12th most common cancer. And in 2020, there are about 500,000 new cases and 470,000 deaths from pancreatic cancer worldwide. Now, sadly, most countries are seeing rising numbers in both cases and deaths. And here in the U.S., the American Cancer Society estimates that in 2024, about 66,440 people will be diagnosed and 51,750 will die from pancreatic cancer. And that's why, it's important to talk about. So why is it so hard to catch early? Well, the pancreas is located deep inside the body, so early tumors can't be seen or felt during regular checkups. And right now, there are no routine screenings for the average person because no test has been proven to really lower the risk of death from this cancer. And by the time symptoms appear, the cancer is often advanced or has already spread to other organs. If you ever notice unexplained weight loss, yellowing of the skin, or stomach pain, please see your doctor right away.
We're talking about that lower back pain as well that some people have experienced. How can this be prevented? Can it be prevented? And how can people get involved in World Pancreatic Cancer Day?
Yeah, all key questions, right? So unfortunately, we can't prevent most pancreatic cancer, cannot at this time. But you can lower your risk by eating healthy, keeping a healthy weight, quitting smoking, and limiting alcohol, all things we can do. Other risk factors include sudden onset diabetes, chronic pancreatitis, which is inflammation of the pancreas, and a family history of pancreatic cancer. If you're at higher risk, please talk to your doctor about early screening, imaging tests, endoscopic ultrasound, which I do. Now, while survival rates are low, 11% here in the U.S., complete remission is actually possible with early detection and treatment. And the only way to cure it is to remove the cancer surgically at this time. But surgery depends on whether the cancer can be removed or if it's spread. Other options include chemotherapy, radiation therapy, immunotherapy, and possibly clinical trials for a new vaccine designed to kill pancreatic cancer cells. As for getting involved, you asked me about this. In World Pancreatic Cancer Day, there are plenty of ways to participate. For example, wear purple. It's the color for pancreatic cancer awareness. Join local or virtual events to raise awareness and support patients. Please donate to organizations funding research and advocate for better research and detection methods, and spread the word and honor survivors by telling their stories. And by joining the cause, you could help to change the future of this disease. And remember, if you or a loved one are concerned about pancreatic cancer, please talk to your doctor right away. And some of the atypical symptoms, get familiar with them so you get them early. Lots of people say, well, it's back pain, it can't be this. So you have to get to the doctor, get early detection, and that's the only way we can get treated.
Thank you, Doc. Appreciate the
pleasure,
information. And this week on the Dr. Nandi Show, the rise of genetically modified organisms in our food has sparked intense debate. The doctor takes a look into GMOs and their potential health impacts this Sunday afternoon at 4.